Good morning, everyone. I'm QV Harkinananga from BSN 212C. So for today's procedure, I'm going to do the donning and removing sterile gloves. So the purpose of this procedure is to protect the hand when the nurse is likely to handle any body substances. And for the equipment, we only need is surgical or sterile gloves. So first is perform thoroughly hand washing and drying of hands, and this may remove bacteria from sterile surfaces and reduce transmission of infection. Now, remove outer glove package wrapper by carefully separating and peeling apart side. Prevent inner glove packages from accidentally opening and touching contaminated object. Now dust inner package and lay it on a clean, flat surface just above wrist, and sterile objects held below wrist are considered contaminated. Now open the package, keeping gloves and wrapper inside surface, and the inner surface of gloves package is sterile. If gloves are not pre-powdered, take a pack of powder and apply lightly to hand over sink or waste basket. Powder allow gloves to slip in easily. Identify right and left glove. Each glove has cuff approximately 5 cm and 2 inches wide. Glove dominant hand first. Proper identification of glove prevents contamination by proper fit. With the thumb, index, and middle finger of non-dominant hand, gust and edge of the cuff of the glove for dominant hand, touch only glove inside the surface. So by starting that, you need to only touches this side. We're not allowed to touch the inner part because if I touch that, it's considered contaminated. So I'm now going to start doing it in this side. Avoid touching the outer side because this may be contaminated if I already touch it. So you must only touch the inner side. I mean the outer, don't touch the outer, only the inner. And yeah. Next is we need to do the other hand. So next, as you can see there, that I only touch the inner side because I'm using my hand that is not that is clean. So next is, as you can see here, this part of the glove is not contaminated. So I'm just going to insert my finger here and tap my thumb. slowly and surely. And avoid then pull that's it. And then carefully pull the glove over dominant hand, leaving cuff and being sure cuff does not roll upwards. Be sure thumb and finger are in proper space. If glove inner surface touches hand or wrist, that is not sterile. With glove dominant hand, slip finger underneath second glove cup as what I've been doing there before. Cup protect glove fingers, sterile touching, sterile prevent glove contaminants. So adjust each glove so that it fits smoothly and carefully. So by doing those stretching thing, I'm already adjusting my glove. By now look at that, it fits perfectly. After second glove is on, interlock hands and cuff usually fall down after application. Be sure to touch only sterile side. By doing that, ensure smooth fit over finger. So next, after you use this glove, let's assume it's already contaminated. So we need to remove them. Using dominant hand gloves, glove hand, or any which you're comfortable with, just the inner glove and remove by inserting it, keeping the contaminant area on inside. Continue to hold onto gloves. Contaminated area does not come in contact with hands or wrist. So now you can do this. Slide finger of ungloved hand inside the remaining glove. Gauze glove on inside and remove by turning inside out over the hand and other gloves. Now, as you can see there, I'm already. Now, discard glove inside the wrapper in appropriate container and wash your hands. So, hand washing reduce the spread of microorganism.